care lead for community primary and integrated care at NHS England and Improvement, and I'm the lead for our carers programme nationally. We're absolutely delighted to have you with us this afternoon. Thank you so much for giving us some of your precious time. I know that we are certainly not out of the COVID woods anywhere near yet, so appreciate how many conflicting demands there are on your time. So great to have so many people joining us, and for such an exciting reason as well. So today we're going to be talking through an exciting bit of progress around our long-term plan work and a piece of partnership work with Carers UK that hopefully will support us in delivering some of that. So I know that Helen has already put a message in the chat box, just letting you know that this session is being recorded. Obviously, we've had lots of people register for this, but things do come up on the day. So we will be making the recording slides and links to various resources available afterwards. Please do put questions in the chat box as we go along. And when we get to the question and answer session of this session today, if you can use the raise your hand facility on Teams to do that, and I will do my best to chair and work our way through those. The only other thing to say is, as with all things Teams, please bear with us if there are any tech dramas. As I'm sure you're well aware, over the past 18 months, it has been a learning process in using these new systems. We have had a test run today. Everything seemed to work perfectly, so that's the perfect situation for then it not to this afternoon. So please bear with us if we just have to fiddle around a little bit. And I will give my personal apology now. My dog at the moment is sleeping beautifully beside me, but he has a habit of barking the second a horse goes outside or he thinks the postman's anywhere within a 10-mile radius. So I will mute myself if he decides to be vocal, but apologies in advance. So if we go to the next slide, please, Hayley. Great, so this will just give you a bit of an overview around what we're going to be hearing about today. So you've already met me, which is good. We're going to be hearing a couple of carer stories during the afternoon, and my thanks to Jodie Deards, who is our carers lead in the East of England, who has made sure that we've got those recorded so carers' voices are front and centre in what we're doing, as always. But the main chunk of the afternoon is going to be taken up by Carers UK, who will be sharing their digital resource for carers and the Jointly app with you. And as you can see, we do have some space in there for questions and answers too, of which we hope there will be plenty. Next slide, please, Hayley. And the next one. Ahead of myself. So I am sure that most people now are very familiar with the long-term plan. It has obviously been in a bit of a hiatus with the advent of COVID, and it really making it very difficult for people to carry on prioritising a lot of the things that were front and centre within the objectives for that. But I think the ambitions have stayed very much true. And I think one of the really heartening things about the work for unpaid carers is that we have seen a lot of localities absolutely push forward and do some phenomenal things, really recognising that actually the isolation experienced by carers and some of the challenges experienced by carers have been magnified during the pandemic. So those ambitions of the long-term plan around making sure everybody is getting the best start, delivering world-class care, and supporting people to age well really map closely to what our ambitions are for carers, as do the thoughts that there were around approach, the idea of doing things differently, letting things be very much carer-led, thinking about how we tackle health inequalities. And we know from the GP patient survey over the last few years that we have seen increasing inequalities in carers' health versus their non-carer peers. And I think even more concerning is that since we've started including 16 and 17-year-olds in that survey, we've seen a real widening of the gap at that very early age. So actually the opportunity to be proactive and do something different for carers is a real opportunity to take on quite a significant public health priority. And if we're thinking about how we reduce the number of people who need care and support as they get older, then actually thinking about carers themselves is a really good way to go about it. So we were really delighted to have a strong foothold in the long-term plan. And a lot of that focus is around primary care with our implementation of quality markers in primary care, if you like, the framework for the so what you do with a list of carers within a practice. work that people in my team are leading around recognition for carers from vulnerable, frequently excluded communities, support for young carers, and then the thing that we're really going to be focusing on today, which is support for carers with contingency and emergency planning. So we've got the so what with the quality markers, and then the how on earth do we do this with contingency planning, the what ifs, if you like. Next slide, please. So I'm not going to read through that commitment in detail. Hopefully people will be familiar with it. But what we are really clear about is that when the what if situation comes up for someone, and it is a what do I do now, it is really, really frightening for a lot of carers. And our ambition is to make sure that every time a carer is identified, that there is an offer, and it's not necessarily going to suit everybody, but there is at least a basic offer that we can put out to people that will help certainly practitioners in terms of their capacity to think about what they do and how they can support the people that are sitting in front of them, possibly quite distressed, but also how we can build capacity in terms of those more complex people for whom this low level offer might not be quite right. So the things that we're going to share with you this afternoon, I think are absolutely brilliant. I've certainly used the Jointly app and found it incredibly helpful for me in my caring role. But I'm also very well aware that isn't a one size fits all. So please don't come into this session thinking we're going to tick all of your boxes and make every single problem go away. We absolutely can't do that. My magic wand is not that powerful. But what we are, I hope, going to do is make an offer that will make the ask on you from patients and their families a little bit more easy to manage when you first come into contact and identify someone as a carer. Next slide, please. So contingency planning, I guess we all think slightly different things about it. And it is that what if scenario. So contingency planning is really about thinking about our responses to different situations in advance. So what happens if a carer themselves becomes unwell? What happens if the person they care for's situation changes? And there are some really great examples of that in terms of things like dementia, which we know is not a linear condition, where actually someone can go along being absolutely fine for a long time, and then it might just take a small infection and that person's life changes quite significantly and they don't bounce back to where they were before. So this is about us thinking in a forward way, being really constructive, thinking about those what ifs in as positive a way as we can, so that hopefully we prevent carer crisis going forward. Next slide, please. And I guess that just reiterates it, doesn't it? And you may well have seen this slide. We've used it across the team with various different presentations before, but I think it really rings true that most people as they start life don't necessarily anticipate things being really, really complicated. You know, we think about our lifespan ahead of us and we hope maybe we're going to have nice jobs, have opportunities to go to nice places. Hopefully we'll have family, friends, whatever structure that is for us. But actually the reality for most people is quite different. And I think the reality for most people these days is that the likelihood of you becoming a carer is incredibly high. The data that we had from the last census said roughly 10% of the population were carers. But actually the data that we have from the GP patient survey in terms of their respondents doubles that. And it's going to be really interesting to see the collated results of this year's census when they come out next year in terms of the numbers of people identifying as a carer off the back of the pandemic. I imagine it is going to be hugely, hugely different. And I think it's just important that we acknowledge the likelihood that this happens. And actually it's quite scary. I've had a long time as a carer. I started off caring for my dad who had vascular dementia and I supported him to the end of his life. I then became a carer for my mum who had neglected her health while she was caring for my dad, and then subsequently have become a carer for my daughter who has a complex mental health condition as well as autistic spectrum disorder. It's certainly not that first chart. It wasn't quite what I had planned when I was going through school, looking at university, doing my nurse training. Things turned out differently, but it doesn't mean that they can't be positive with the right support. Next slide, please. So I think it's really important to understand where carers feel they are now. And there's certainly a variety of approaches across the country and some really good proactive work doing to support people. A lot of it is local authority or voluntary sector led, and there is quite a disconnect within health and social care and the voluntary sectors in terms of how those things are managed. So the work that we're doing is really to try and look at a simple way of joining some of that up as we would hopefully work towards more integrated care records, finding something that will help us provide a basic tool that reads across different systems. And I think really important to think about what carers' experiences are. The survey that you can see was a very rough and ready one that I did on Twitter probably a couple of years ago now, asking carers who'd had a carers assessment if they'd been supported with developing a contingency plan. And the answer was overwhelmingly no. And a lot of people were coming back and saying, well, I am actually the contingency plan, which I think is how the majority of carers feel. And people saying, well, if anything goes wrong, well, tough luck, you're on your own. And I think, again, that was very much reiterated by a lot of carers going. And I think back to my first carers assessment that I had, and I asked about contingency planning. Someone wrote it on my behalf, not with me. And the contingency plan for my daughter was that if she goes into crisis, then you can call the police, which I can say very, very firmly for a teenager with a mental health problem would be absolutely the wrong thing to do. So there is a real gap in terms of what we're doing and how we're supporting people. And I think it's, if we can get this right, it's the type of thing that will help us work more proactively, more cohesively across systems, really thinking about how we integrate our work within health, social care and the voluntary sector, and look at how we really prevent carer crisis by looking early on at the things that might help. So next slide, please. So before we hand over to Carers UK's team to go through the offer around Jointly and their digital platform, we want to start by just sharing a carer story with you. So our thanks to Jodie again from East of England for supporting Jo, the carer, to make this short film. Hayley, I'll let you play the film.
I'm sorry, I'm just having some issues trying to get it to play.
One of those things that Jen mentioned that we tested earlier and it worked very smoothly, and now lo and behold it's deciding, oh, I'll stop talking. We've not got any sound, Hayley.
Sorry, can you hear the sound?
No, we can't hear the sound.
Right, I'm just going to, sorry, just bear with me. I'm just going to try taking the slides down and putting them back up.
No problem.
Thanks, Hayley, and apologies everyone. As I said, it's the joy of technical things. You do a run through and everything works fine, and then the second we want it to work, it doesn't. So please bear with us.
a stroke. He's completely dependent on me to make sure that his life is as flexible as possible.
Can you hear the sound? Can you hear the sound?
Yeah, we can hear it. Yeah.
Oh, right. Sorry.
And he can access things, but with that dependence on me goes a huge amount of responsibility for me. And the biggest thing that I really struggle with is that if anything happens to me, who is responsible for him? I've got what happens if anything happens to me. I've got one of these lovely plastic cards in my wallet, which I realised the other day, since I don't have money anymore, I use my phone to tap to pay for everything. I don't carry my wallet. If I was in an accident, nobody would know that I'm caring for somebody. I've got nothing on my phone. I've got nothing that says that I'm a carer. I need to have a tattoo or something. When they strip me off in A&E because I've had a car accident or something, it will be tattooed on my shoulder. I'm a carer. There's someone at home waiting for me. I've got sitting in my inbox at the moment is the revision that I need to do. But the biggest challenge I find is that every time I have to talk about my husband's disability, every time I have got to tell somebody why it's challenging and why it's difficult and why there needs to be this certain level of care being put in and what needs to be picked up, I have to go through all the disabilities. I have to go through everything he can't do. I have to re-engage with how disabled he is and how life has changed completely, just so that somebody has that information, so that if anything goes wrong, that person who then becomes responsible for Graham, that they know what they're doing. Got to make sure that he's safe if something happens to me. But it's really hard to get all of that information in this short little plan, because every day I'm with my husband is different. Every day I don't know what his anxiety is going to be like. I don't know if he's going to be able to take his medication or not. I don't know if he's going to be able to talk or not. I don't know if he's going to be able to understand or process what I'm doing. And how do you put that into a document for someone to pick up if something happens to me, to then go, oh, I know how to look after this person and we know what to put in, when even I don't know from day to day what's going to happen. I'd much rather it wasn't happening, to be honest. I would much rather not have to write a plan.
Brilliant. Thank you. And I think that's in that very short snapshot, you would get that very clear reason, don't we, why contingency is just so important. You know, when things happen, all of a sudden, we really desperately need a way of being able to share what matters and what will help and who can help as well. So I'm delighted to be joined by our colleagues from Carers UK. So Madeline, Emily, Maria and Juliet will be taking over the next part of this session just to talk you through the platforms that we're going to be offering to primary care to use and give you a sense of how this might support contingency planning for the people that you come across. So I'll hand over to our colleagues from Carers UK.
Thanks very much indeed, Jen. It's a huge pleasure to be here. We are so excited about this piece of work and the opportunity to reach more carers with the tools they need to access the support they need, and indeed to look at that very critical issue of contingency planning. So what I'm going to do in this short session is to take you through the Digital Resource for Carers platform before handing you over to my colleague Maria, who will actually give you a bit of a deeper dive into our care coordination app jointly. So as always, one has to pray that the tech behaves as it should. So I hope everyone is able to see this. So this is the landing page for the digital resource. So when someone goes to the carersdigital.org web address, this is what they'll find. If they haven't created an account using an access code, and more about access codes in a moment, they will simply go to create an account, and it's a very, very straightforward process. It's every much as easy as setting up your Amazon account, email address, password, your first name, surname, and the access code that will be given to each STP or ICS footprint. So again, I'll explain more about the codes later. But I've set up an account for the purposes of our demos today. So let me just take you straight into the resource. And here is the digital resource platform for Hertfordshire and West Essex STP. This is a live page, and you'll see here the code that's been allocated to the STP footprint. So anyone within that footprint, primary care, will be able to use this code, give this code to carers to use and to access the platform. And here's my account with resources and logout. And what I'll do first is just scroll you right down the page to show you what it actually includes before dipping into the different categories of information that it hosts. So on the left, you'll see these categories of information. First is health and well-being. This is very much about the health and well-being of the carer, though it does also touch on supporting the health and well-being of the person that they're looking after. But this is so important to us to make sure that carers do look after themselves. They are much better able to care if they can. Support for caring, which is about support for the caring role, accessing external services and support, whether that's in the community and voluntary sector or statutory sector, or indeed building networks of family and friends. Technology and caring, and more about that, and obviously we'll be showcasing jointly. Financial planning, and a section on working and skills. As Jen said, significant numbers of people are not only caring but working and caring. And in the NHS, we know from the last NHS survey, workforce survey, that is 1 in 3 people who are working and providing care. On the right, you'll see access to some generic resources that Carers UK provides. Critically, our COVID-19 guidance, which is updated pretty much on a daily basis, as indeed the essential information on accessing the vaccine. And you'll see here my backup, and more of that later. That is the first of our digital contingency planning tools. And here a link to the Carers UK forum. And at the bottom of the page here is a space, and you can use this to actually create customized links so that the STP or ICS footprint can actually include links that are relevant to the locality. This might, in Hertfordshire and West Essex, for example, involve links to the local carers organisations or carer centres that carers can go to directly. So a little bit more detail in each of those. In the health and well-being category, here are some of the resources included. We have You and Your Wellbeing. This is a very comprehensive e-learning programme that we developed last year with Bupa UK Foundation and was added to the platform as a new resource. 2 hours, but you can dip in and out of it. Carers can use as much or as little of it as they like. And it covers physical and emotional well-being, things like resilience, well-being, physical activity, strategies for well-being, emotional and mental well-being, at dealing with mood and indeed loss, which is a really important area. We've an e-learning programme on nutrition, which we've developed in partnership with Nutrition, who are nutrition experts, and that covers the kinds of support a carer might be given the person they look after, but also the importance of looking after their own health and well-being and nutrition. Looking after your health, taking a break. A lot of the information resources here link directly through to Carers UK's web pages. That's particularly important for us because we know then that they are regularly updated. So these pages are kept bang up to date. So this does not go out of date. And you'll see here the kinds of information that's included within that section on the Carers UK website. Okay, I take you into the next pod, which is all about support for caring. Here we go. And we have here another e-learning programme about me. This is all about building resilience for the caring role, and it includes topics like how to build a help network. And as I said, that might be a friends and family network, more of that with the Jointly app, which is designed to do that by creating circles of care, but also how to find local resources and services, as I said, in the community and voluntary sector, or indeed in the statutory sector. And Upfront Guide to Caring is a simple digital tool, a self-assessment questionnaire that you complete, and it basically navigates the Carers UK website to give you the information that's specific to the question you want to ask, which saves you a lot of time and energy in navigating our site, which is a brilliant information resource, but very dense, and this saves a lot of time. I'm going to take us through my backup, so I won't linger on that now. Looking after someone is our information guide to support and rights and entitlements for carers. We update this every year and reissue it in time for Carers' Rights Day, so the next edition is imminent. And we have a self-advocacy guide for carers, which was developed in partnership with carers themselves. So most of this material is co-produced. So I don't know why it wants to log me out. Co-produced with carers so that we know it's relevant to them. The technology and caring section, I'm not going to linger on jointly because more of that in a moment, but we do have here a very, very useful resource on the types of technology that can support caring. And again, a link to our own website, which has some very comprehensive resources indeed on tech and care, including a video which really helps set the context for people who don't really understand what the potential for technology and caring might be. My next section is on financial planning. Again, another e-learning resource here, which we developed in partnership with the Money Advice Service, thinking ahead, the cost of care and support. And we know that people really don't think about the costs of care in advance, and when it hits you, it can be an extraordinary shock. So this is a tool that really helps people understand what those costs might be and to manage them more successfully. The financial support and managing someone's affairs sections we think really are critical. Financial support, again, links to a lot of information on the Carers UK site. Benefits we know are really important to people, and so few people know exactly what they are entitled to. So this gives a direct link to our site, which also includes a benefits calculator. And managing someone's affairs, lots of information about things like power of attorney, which again we know can be a real issue if people don't understand when they should actually be putting something like that in place, or indeed that they can have different types of power of attorney. So the final section, very relevant, as I said, to the to working carers and all of those who are juggling care with paid work, the majority, and that has again another e-learning programme, Working and Caring, which looks at topics like telling your employer that you're a carer. We know that disclosing the fact that you're a carer in the workplace can be really very difficult indeed, but also covering off things like legal rights, flexible working and leave arrangements. These are dealt with in more detail in all of these guides here. These guides are produced by Carers UK and Employers for Carers. And we also have Learning for Living, and Learning for Living is an e-learning programme which is designed to help carers recognise and validate the skills they've gained through caring and which might be transferable. And that validation can support things like continuing professional development, or indeed for people who have had to leave the workplace can be a really helpful return to work tool. So that is a very whistle-stop tour of the platform, but what I do want to do before I hand over to Maria is to look in a little bit more detail at my backup, because obviously contingency planning is a large part of what we're looking at today. So I am going to create my own contingency planning by using this digital tool. I simply enter my name and email address. And what this does is take you through a whole series of information prompts, which help you to think about what should be included. And it will ask you whether you've thought about this or not. And begin simply by asking, do you have a contingency plan? I'm going to answer no to all these questions because it will then bring up a summary which gives details of what should be included. If you have said no, you can see it covers off services. Do you know what services are available locally? Do you know if your local authority has an emergency scheme? And it prompts you then to ask those questions to find out about this stuff and to put it in your plan. Have you listed the equipment that the person you care for uses, any medication that they use? Have you registered as a carer with your GP? List of any key health services that the person you care for uses, or indeed social care and community services. Do you shop, and would you have arrangements in place if you couldn't shop? Have you prepared a profile of the person you care for? Have you thought about technology? Do you have a power of attorney? Have you had a carers assessment? Has the person you care for had a community care assessment? Do you have arrangements in place for any pets you or the person you care for has? And actually, we know that can be a real challenge. And at the end of that, it produces a summary which tells you how you can find this information, what you might or should include in your plan. Simple tips like fill out the in case of emergency details on your mobile. Didn't Joe make a great point about, we don't carry wallets anymore, but we all carry a mobile phone. Use a Jointly app to store and share details, etc. So won't go through this in any detail in the interest of time, but that just gives you a very brief idea of how this very simple digital tool can support the contingency planning process and help people create their plan. And you can print it then, or this can be sent to email to you. And I think I'm going to stop there now and hand over to my colleague Maria to explain the Jointly app in more detail. So let me just stop sharing my screen and hand over to Maria to share hers. Thanks, Maria.
Thank you, Madeleine. Let's hope that the tech keeps being on our side as we move on to Jointly. So this is Jointly. Let me try and minimize a little bit so I can see everything. I've seen that a few people have asked a couple of questions in the chat, and I will try to cover as much as I can, but of course we can pick up questions later on. I just wanted to start by saying that when we design Jointly, there's two things, and as we develop it, that we keep in mind. And one of them is that a caring circle may involve people of different technical ability, and we try to design and develop Jointly in a way that it can include a lot of information, but in a way that it can be straightforward to populate. And the second is that people in a caring circle may have different levels of involvement. So we always have kept in mind how we can give and take away permissions so that people can all be part of the circle, but not necessarily see the same information all the time. So I'm going to present Jointly through the web app, but only because we are on the internet right now. But Jointly has also native iOS and Android apps that can be downloaded from the App Store and the Google Store, and they can be used on any iPhone, iPad, Android device, and phone. So users can interchangeably go through different devices, so you can use Jointly on the go during the day on your phone, but when you come home in the evening, you might want to use your laptop or your iPad to do any activity there. So this is what a Jointly user will see when they first log into Jointly. This is the main page, and you can see that on the top we have the search function, and the search function can search the entire app, or it can allow you to search within specific sections of the app or specific circles. Some of our users, most of our users will have one circle, but some of them will care for more than one person, so they may choose to create more than one circle. I have 4, that's very rare for someone, that's because I'm an admin, but this functionality will allow people to search within specific circles. The quick add button will allow users to quickly add a new message, note, event, task, medication, or contact without necessarily navigating through the menu. We can switch between our circles very quickly and intuitively using this function. A user can see their latest notifications, and through this area they can manage their account and they can manage the notification settings. And I will come back to that later to see how Jointly offers flexibility for different people to receive different kinds of notifications. On the left-hand side, you see that we can see the person that's being cared for, their name, image, and how many members there are on a circle. And then we can see the basic functionality, which includes the profile of the person being cared for, a message center, calendar, notes, tasks, contacts, and medication functions. Again, we can see our circles and access our dashboard from these areas. And on the right-hand side, you can see the members of your circle. any invitations that may be pending for people who have been invited but haven't yet been accepted, and you can very easily invite new members in the circle. And by doing that, you can decide how they will be part of the circle. So jointly allows users to be joined as administrators, and that means people who have access in all the areas of the app, and they can make changes to the app, and people who have limited permissions and they can see specific areas of the app. So through your invite, you can decide whether someone will be joined as a circle administrator, whether they will be able to edit medications. Everybody can view medications, but people can limit whether they will edit medications, and that's to make sure that people who edit medications have the right to do so and nobody messes with people's medication. Then they can decide whether people will see private category notes, and that's a way to include information that not everybody sees, and then whether they will be appointed as an emergency contact. So you can decide that as you invite someone, or an administrator later on can change these permissions. On this area of the page, we have some support information for users, including an at-a-glance guide and a more detailed guide, frequently asked questions, and a button that can send you directly to the Carers UK support team. So if a user had a problem that they needed to resolve, they wouldn't come to you, they would come directly to us, and our technical support team would ensure that they have the support they need. Then on the main area of this page, you will see that it summarizes the upcoming tasks and events so that users can see that at a glance, together with the recent circle activity since the last time someone joined. Then if we move on to the profile of the person being cared for, this is an area that all the members of the circle will be able to access, and it will include information like their name, their date of birth, what they like to be called, their condition, illness, disability, or caring needs, any dietary requirements, allergies and intolerances, any likes, dislikes, or everyday preferences, details of any particular difficulties, or any assistance they have with and any needs. However, you can also, by clicking Edit the Profile, add additional information, and that has become part of our contingency plan tool that we developed through Jointly. And this information can only be viewed by the people that have permission to do so. So carers can choose to include more sensitive information that might be relevant in case of emergency. And that may include the home address, property access information, landline or mobile numbers, brief details of medical history, how long a person can be left unattended, their NHS number, whether there's any power of attorney, or information about pets, faith or culture. It's a very flexible part of the app. You can see that the fields can be moved and ordered in any way someone would like. Irrelevant fields may be deleted entirely, and new fields can be added to ensure that every information that is captured here is exactly relevant to the caring situation of a person. Now, when someone wants to export a contingency plan from Jointly, this will include the basic profile information, the additional information that is stored in this list, together with the contacts and medication information that is stored in Jointly. And the way to export the plan is very easy. You go to My Account, you click Export Your Data, and that downloads a PDF that includes the information I just mentioned. Then if we move on to the message center, this works like any other messaging facility that you may have on your phone, like your texts. You write your message here, you can attach images if that's relevant, and then you post it. And then, of course, the thread will go like any other texting thread, with the difference that here you can delete messages if you want to. Moving on to the calendar. That works, I'm sure everybody has used a calendar for the professional and personal lives. It works much in the same way. You can put events that are relevant to the caring situation. For example, here we have collect medication, we have hospital appointments or some leisure activity, but any activity that's relevant can be added here. What is interesting, and we have recently developed, is the unavailability of carers. So we have a function that can help people let their circle know when they would be unavailable to care, and that can help a family or a group of people coordinate care. For example, in this case, I would be unavailable between the 2nd and the 9th of September, and if more people were unavailable, more callers would be here assigned with their names. You can view the calendar in a month, week, or daily mode that helps people coordinate their care in this way. Moving on to the notes section, this is a section that we have developed in the last couple of years, and that has come as a response to user feedback about how they would like to use Jointly. And the idea of this section is that it's entirely flexible for people to use exactly as they would like to. It starts empty, so people can create their own categories, and they can hang notes under these categories. And they can decide whether categories will be public for anyone in the circle to see, or whether categories will be private for specific members of the circle to be able to access. For the purposes of this example, we have created 4 categories, and that has to do with Pogo, the dog, and an important information. Grocery for dad, important information for dad, and health information for dad. And you can sort this by new, old, or title, but more importantly, you can sort it by category. And that means that if you have many notes under all these categories, you can very quickly see what's under each category. It's very quick and straightforward to create a note. You add a title and a brief description. You can assign it to an existing category, or you can add a new category. You can upload an image if that's relevant, and you can attach a file, and that can be an Excel, a Word document, a PDF, or an image file. So anything from spreadsheets or bills or any other health information that may be relevant can be hung. Very easily, you can see whether there are photos or attachments in your notes, and then by this function, you can edit or delete notes very easily. Moving on to tasks, this is where you can create and assign tasks either to yourself or other people in the group. This is a quick view. You can see all the tasks and when they're due. You can also see your personal tasks, and thank God I have nothing to do today, nothing unassigned, and then you can see the tasks that are assigned to other people. When you have completed, you can very easily edit or delete tasks by this functionality, and then when a task is completed, you can just tick this box and the task moves on to the completed list. It's equally straightforward to create a task. The only thing you need is a task title, and if you choose to, you can include when it's due, who is responsible for the task, whether you want to add it to an existing list, or you want to create a new list for the task, whether you want to assign it to an existing category or create a new one, and then you have the opportunity to add additional notes or ask jointly to remind you about the task in specific times. Going back to the contacts page, in this area, people can see 2 things, 2 groups of contacts, and one is the circle members, their details, email addresses, phone numbers, and whether they have been assigned in case of emergency. And they can also store any other contact that can be relevant to this caring circle, and that can be health and care professionals, any other professional that may be in contact, your vet, or even the person that will come to maintain the garden or provide any other assistance, a friend or a neighbor that may be needed to help. When you access jointly from your phone, all these phones will be able to be directly called or dialed from the app. Finally, the medications area. It is storing any current or past medication that a person might have taken. There are 2 ways to view medication, and one is the medications for the day, and these are stored according to the hour a person will take them, and they will include information like purpose and dose. Or you can view medications. In this view, which shows the current medication that someone is taking, or the medications that someone was taking in the past. And it's equally easy to add information about the medicine. The name is the only thing that absolutely has to be there, and the date that starts. And then from there on, you can add information about purpose, how often, dose, image of medicine, which is quite useful if you're asking other people to administer medication, but also you can add information about end date, location, where it is in the house, and that is very important if you're thinking about your contingency planning, if you're going to give instructions to other people to where the medication is, and then more information about how to administer medication or other relevant notes. This concludes the main functionality, but I wanted to very briefly show you a little bit the notification center. As we said, we take into account that different people will have different levels of care and different levels of involvement in someone's caring circle. So people can choose or not to receive a daily or weekly digest with recent activity, but more importantly, they have a lot of flexibility in terms of switching on and off notifications and choosing where they're going to receive them. So you can receive notifications on your phone or your email, both or none. And you can decide through a lot of granular detail here what kind of notifications you want to receive, because we have seen that people may want to receive very little or a lot, depending on how much they are involved in a caring circle. And this, I think, includes the main functionality, but of course, I know there have been questions in the chat. We can pick them up as we move on to the Q&A. And I will try to stop sharing at this point. Here we go.
Brilliant. Thanks so much, Maria and Madeline. That was really helpful. And I know there was a lot of information to be shown there. And just to pick up on a couple of questions that were coming through the chat box as we were going, someone made a very good point about technology isn't for everyone. And I think our answer is absolutely. And as I said at the beginning, this is about finding something that is an offer at quite a basic level and absolutely won't suit everyone. But actually, if you can get in proactively with the right people, hopefully what it does do is then release some capacity for doing something different with those who require a bit more support and input, and there will be plenty of those. So I think what we're trying to do is, we know that there is a big ask within the long-term plan around contingency planning, and we also know how pressured primary care in particular is. So by giving an offer of something like this, what we're hoping to do is prevent it being an overwhelming ask, so that there is a tool that will at least help a significant number of people. Verity, you've been looking at questions. Are you able to feed some questions in?
Yeah, definitely.
Thank you.
So the first question, I'm going to ask the kind of technical questions first, is around whether you can invite people through adding a mobile phone number rather than an email address.
No, Jointly currently works with email addresses because it assumes that not everybody will access it through a phone. People may not have a smartphone and they may access the web app. So we have made the decision that Jointly will use email addresses for inviting people in. But we are looking, obviously, Jointly has been in development and changing all the time. We're listening to users and to professionals all the time to understand how different people use it in different ways. This is how we have developed the notes. This was not a functionality that was there from the beginning, and it has become one of the most used areas of the app right now, together with the medication. But the idea is that we want to ensure that everybody can use Jointly, whether they have a smartphone or not. And that is why for right now we're using email as the way to invite people in.
Thank you. So the next question, again, a technical question, so possibly for you, Maria, is there a facility to shout out to the circle to pick up a task rather than to assign those tasks?
You can use different areas of the app. So depending on how big or small a circle is, we see people using Jointly in entirely different ways and shaping it in how they would want. So the message center is an easy way for someone to say, can someone pick up a task? Otherwise, you can directly assign it to someone and they can accept it, or they can assign it to someone else.
Okay, that makes sense. So a kind of a similar question is, can you use the app to create an SOS alert that will ping an alert to others in the circle if help is needed in a crisis or an emergency situation?
It doesn't have that functionality directly, but obviously assigning a task or messaging people will do that. It doesn't have a button that says SOS, do something, but that's actually quite an interesting comment, and I will make note of it.
Thank you. The next question is, and I know this is something that Madeline and I have spoken about before, is whether it's possible to create an API link between the app and primary care clinical systems, so we're sharing information and keeping the data in real time. Well,
Jointly does have an API already, and it is connected to devices, and it's a area of the app I didn't show. It just didn't want it to become too heavy. The question is not technical, but it's practical, whether you would want to share data, whether this is people's personal data, how much or how little they would want to share with the NHS. And then, of course, when linking with the NHS, there are kind of other considerations in terms of whether you have the right levels of security and so on in the app itself. So technically the answer is yes, but there would be other considerations. Madeleine, I don't know if you want to add anything.
Yeah, I mean, it's an issue with connecting to statutory services because of the levels of permission. And it's actually much harder on your side than it is on ours, I'll be quite honest, Verity. So it's not something that's been achieved yet, that seamless flow of data between an individual and NHS. I mean, I know it's something that exists when people are using remote monitoring devices, for example. We haven't cracked it yet. I think there's an awful lot of work that needs to go into it. But I do think it has to be the Holy Grail, where devices do connect quite seamlessly into statutory services. That would be the ideal.
Verity, you're on mute.
You're on mute, Verity.
And my mouse disappeared. I was just going to update on some work that we're doing with NHS Digital, which links to what we were just talking about, and also some of the questions that have just popped up around kind of the link into the patient record. And we're looking at developing a new SNOMED code, or an existing SNOMED, or kind of making efficient use of existing codes to enable us to identify in primary care whether the carer does have a contingency plan. And also, with it being in the summary care record, it will enable that read across from primary to secondary care. And that's something that we're working through at the moment, and we're hoping will be able to launch at a similar time to the kind of the larger launch of this app, to enable, exactly as you're all identifying, that read across, which is ultimately the long-term plan delivery in terms of how the people that need it most, as in Joe's story, are able to access that information. So hopefully that's...
Currently, you can make your plan available, of course, to a health professional. That's why we created the export function. But that currently is the only way that you can do it. You actually have to do it manually, if you like, with digitally, but you have to make it happen. It can't happen between app and system seamlessly through API yet.
Another question is there a young carers version of that?
No, but it is for everybody. Any person can use it, young, however young or old they are, as long as they can log into a computer or have a smartphone, then they can access jointly. And the caring circle we have seen to include many different people, ranging from young carers to older carers, to provide support around the person. And many times it actually includes the person themselves. So when younger people are being cared for, they are actually part of their caring circle, and they can manage the information as well.
Yeah, so younger people with disability or learning disability, they actually enjoy very much being part of the circle, so they're included very actively. So yeah, it's designed to be really flexible in its use for carers.
Thank you. The next question is, will it jointly include subjects such as advanced care planning and annual health check information?
Well, the reason we have created the notes in the way we have is to enable people to store and record any type of information that they would want. And that functionality allows them to attach any kind of documents they would want in the notes that they create. It was really a response from listening to users and how flexibly they want to create information, they want to use the app and store information on it. So by using the categories, you can use and create unlimited number of categories, and you can store unlimited types of notes under each category. So you can definitely use this area of the app to add anything that is not prescribed by us in Jointly.
And of course, you can upload the relevant documentation too.
Exactly.
So you could upload your care plan into the app.
And we've seen people uploading things like their bills or their recent blood test, recent exam. I mean, anything that you may have on paper can be uploaded, stored, and accessed by your caring circle.
Thank you. The next question was around the accessibility of the app. So in terms of whether it's been tested, for example, with people with learning disability and autism was the example given.
We have created with carers, not with patients, because it is for carers. So we haven't had any negative or any feedback coming back from people not being able to use it, but bearing in mind that the app has been co-created with carers rather than the people that are being cared for.
Another question just popped in around translation. So in terms of other languages.
It is only in English and in Welsh at the moment. It is challenging to maintain an app like Jointly in many different languages and dialects. And the reason is that it's changing constantly and it improves constantly. We don't have this in plan for this year, at least.
I'm quite mindful of time. There are some other sort of more technical questions that I think would be really useful for us to almost do a written response to, if that's okay. So we will keep and collate all of the questions that have come up, and when we send out the slides and the recording link, we'll endeavour to also send a sort of more full response to all of the other questions that have been there, because I think there are some quite technical and useful questions on there that we may not necessarily know the answer to, but may have to dig a little bit with our NHS digital people as well as the people at Carers UK. But
Jim,
thank you for that.
Can I just add something? I didn't mention it as we started, and maybe it's not self-explanatory. People would be able to, so through the digital resource for carers, you would have an access code that Madeleine referred to. The same access code can be used for users to download Jointly for free. So in a specific locality, people would use the same code. They would go to Jointly on their app store or online, and they would use this code to download Jointly. And that's the way they would get it for free without having to pay the Jointly fee.
Brilliant. So thank you. That's really, really helpful. And as I said, this is about us creating an offer that hopefully will help with the ask that is in primary care at a very challenging time. We are very, very conscious it's not going to be right for absolutely everyone, but I think the capacity that it has to really help a lot of carers think proactively for themselves and start thinking around those contingency planning themes is really, really helpful, and particularly that my backup, thinking about their own health and well-being too, as that's absolutely fundamental to whether or not people are able to continue caring. I'm conscious we're down to our last few minutes, so I'm going to hand over to Verity to just talk through the feedback that we'd like to get as we do a soft launch of this and test out how you find using the app and the platform. We'll probably have to cut short after that, but we will send the other carer's story that we have after Verity's gone through her feedback.
Thanks, Jen. Can I have the next slide, please, Hayley? So in terms of exactly as kind of Jen and Maria have said, we want to learn from you and your experience of kind of using this app and sharing it with your carers so that other practices have a positive experience when we roll this out nationally. And part of the feedback we would like from you is around kind of who will lead the rollout in your network, how are you communicating the offer to your carers, kind of is the resource helping you to identify new carers, but also is there anything that you need from us to make this easier for you? So is it kind of a banner on your website is that we could create with Carers UK to enable a kind of a standard way of offering this to your carers? Is it a leaflet, kind of some feedback from you in terms of how we can help you do this in a really practical way, and equally whether there's anything information that you think the carers would have needed or would have been helpful, and how it's benefited you in practice. So we've got a framework of questions that we wanted to ask you. My kind of question to you is how best we can get this information back from you. I'm really mindful that we don't want to increase burden, as has been kind of recognised by Jen and in the chat, a really busy time for you. So I'd really welcome your feedback either now or kind of via email in terms of how you would best like this information to be collected from you. So whether that's sort of a survey link, a phone call at a time to suit you, I would really appreciate your sort of feedback on that.
Brilliant, thanks Verity. So we will draw to a close now. Again, thank you all so much for joining this call today. As we said, this is going to be something that is going to be offered free to ICS localities and the primary care networks within them. It is a general sort of first level offer in terms of contingency. Someone made a really important comment that it's, you know, quite involved and we need to be conscious of time. And I think, just to reiterate, this is something that people can take away and do for themselves. So we're not asking primary care staff to go through that whole planning of circles and putting in the detail. It's about offering a resource that will help carers think those things through for themselves in the first instance. And hopefully, by capturing people early on in their caring journeys, by being proactive with offers of things like this, for those people that digital is suitable for, it will be a really helpful tool that will then in turn helpfully and hopefully give you some capacity for doing the planning with people with more complex and challenging needs. So I know that Verity will be following up with numerous emails and contact details. If you have any questions at all, any comments, any thoughts that you'd like us to go through, any further questions around functionality, please send them in to us. Thank you again for your time. I appreciate it's Friday afternoon and lots of people will be thinking towards the weekend. Lots of people will also be working the weekend, so thank you also for that. Hopefully this session's been useful for you. We will send out slides and responses to your questions as soon as we're able to, but hopefully you will have a fantastic rest of your Friday and a lovely weekend. Thanks again for joining us. Bye everyone.